Thank you for volunteering your time for your local Medical Reserve Corps, called the MRC, or just being interested in finding out more. We welcome that interest. I'm Dr. Julie Watts McKee. I'm the Chief Dental Officer for the Commonwealth of Kentucky. But today, I'm here as a public health official to give you more information about the coronavirus outbreak and COVID-19. As a former public health director, I, perhaps unfortunately, have been involved in emergency responses before. Our health department was key in responding to floods, tornadoes, and ice storms, and more floods. The public health response to the coronavirus outbreak is completely different than those disasters I mentioned. Those had immediate occurrence, and the damage was finite and measurable. The spread of COVID-19 is just the opposite. Its impact is ramping up. It is not finite, and it is only measurable in real time or in looking back at our data and our experiences. Here are some basics to catch you up, to get you ready, to help your community to become more resilient and recover. We're referring to the infecting virus as the novel coronavirus. Novel doesn't mean fictional. It means that it is new. So new that we've not seen this exact virus before. That makes a lot that is still unknown, and no one is immune to this virus, no one on the planet. Current knowledge is largely based on what is known about the other coronaviruses. We're referring to the illness itself as COVID-19. The coronavirus is the agent diagnosed in 2019. COVID-19 is the illness. The newly emerged COVID-19 is a respiratory illness that seems to be spreading much like the flu, as it can spread from person to person. The new virus can cause illness varying from mild to severe symptoms, including potentially resulting in death. The coming days and weeks are likely to bring more confirmed cases of COVID-19 in Kentucky, in the United States, and globally. On March 11th of this year, the World Health Organization announced that the outbreak of COVID-19 is a pandemic. Pandemics move through the following phases: investigation, recognition, initiation, and acceleration. While the U.S. as a whole is considered still in the initiation phase of the pandemic, in states where community spread is pronounced, it is considered in the acceleration phase. The number of cases of COVID-19 being reported in Kentucky and in the country is rising quickly. That increase is expected, given an increase in testing and the ongoing rapid response of the disease across our communities. While these numbers are concerning, the increase is not unexpected. More robust data will allow us to better understand and track the size and the scope of the outbreak and strengthen prevention and response efforts. MRC is part of that response. Because of its novelty, much is unknown about how this new coronavirus that causes COVID-19 spreads. Current knowledge is largely based on what is known about those other coronaviruses. Most often, person-to-person spread is thought to happen among people in close contact within 6 feet of each other. A person can get COVID-19 by touching a surface or an object that has the virus on it, and then touching their own mouth, nose, possibly even their eyes. Right now, testing is limited. We all hope that we see relief in this, and we'll be able to test everyone that needs to be tested. At this taping, 12 commercial laboratories are testing COVID-19 through the state's healthcare system. And here's some frustrating news. There is no specific antiviral treatment for this disease. People with COVID-19 should receive supportive care to help relieve their symptoms. And currently, there's no vaccine to prevent this. The best way to prevent infection is to avoid being exposed to it. We appreciate you volunteering to work with the MRC. What exactly will you be doing? At this moment, we're not sure. But many plans are being made underway at our Emergency Operations Center with the Department for Public Health and will continue to develop as this pandemic unfolds. We'll reach out to you and your specialty as we craft how to best use your skills to care for all Kentuckians. As a volunteer during the continuing outbreak phase of this pandemic, you may wonder, is my MRC work safe? Will I be protected? While this is hard and important work, it is also in the interest of every MRC leader and the entire community that you stay safe from being exposed to the coronavirus. Along the way, your group will use accepted techniques of prevention that include social and physical distancing. We need you to stay healthy to help your community manage this outbreak and then recover. You will also be covered with liability insurance. For your emergency response related work, you will be covered by the state of Kentucky for relief-related liability and workers' compensation should you incur injury or illness. By clicking on the state's website, www.kycovid19.ky.gov, you can find an incredible amount of accurate COVID-19 information and reliable information from the Centers for Disease Control and Prevention. Check it frequently, especially the Healthcare Provider tab, because new content is added daily as this science evolves. Stay tuned for subsequent videos that will help train you to be more comfortable and more confident in your assisting your hometown in battling this pandemic. See you soon. Thanks for watching.